again. So welcome back to another virtual O-Week session. This afternoon's one is all about our health promotion challenges. So we're really excited to get started and share some info about these programs with everyone here. A quick overview of what today's session is going to cover. We're going to do a little bit of background about Challenges Abroad and who we are for any new people joining us here. Look at some of the issues that are faced in the community that work to guide our health promotion programs, and then explore what you actually do on a program and also why your skills as a university student can be really important and really valuable for us. And then we'll quickly look at a typical day-to-day breakdown on our health promotion programs, what you'll get out of it, and then chat to some of our alumni who have been on a program with us before, which we're really, really excited about, and really grateful that they are sharing their time with us today as well. Alrighty, so Challenges Abroad, we are a social enterprise and we were established as a means of supporting our own charity who are called the Future Sense Foundation. The foundation work with our partner communities in 6 different countries around the world and establish grassroots programs focused around the areas of education, health, livelihoods, and the environment, with the ultimate aim of taking action on the United Nations Sustainable Development Goals. One of the main ways that we support the foundation is through our wonderful volunteers who work with them on specific projects that are designed to benefit the community. And as a social enterprise, that also means that we support the foundation financially by donating any profits we have each year to help fund their long-term ongoing community projects. And on top of generating that impact, a really big focus of what we do is supporting the development of young Australians and young students by providing opportunities that really allow you to step outside of your comfort zone, develop some new skills, and re-examine your perspectives on a whole bunch of different things. So our programs really are set up to ensure that as much as you can make an impact, you can also be impacted by your experience. And a quick kind of COVID update. Throughout COVID, we have faced, of course, some additional challenges as an organisation in being able to support the foundation, and also in being able to engage with students around Australia as well. But our key focuses throughout the last few months have really been on how we can continue to meet the immediate needs in the community, and also how we can continue to support our communities without having the volunteers that we normally have on the ground. A few ways we've been able to do that is by having our in-country teams volunteering themselves in the community. They've been helping out at things like COVID checkpoints, providing medical supplies, and putting together some really great homework and education boxes for the students at our partner schools while they are distance learning. And we've also been exploring how we can keep engaging with young people and building their skills, which we've been able to do through our isolation webinar series, which we were running over the last couple of months, and also with an upcoming project, which we're really excited about. And I will be sharing a little bit information about that at the end of the session today. So to know why we run the programs that we do, it's really important to understand and look at the challenges that are faced in many developing countries, and particularly in the communities where we work. So in relation to health, these challenges are on the slide in front of you. I'm going to quickly cover a little bit of background of each one. So one of the first really big challenges that is faced is a lack of access to facilities and medical professionals. So a number of the countries where we work do have fantastic, and in some cases really world-class hospitals and healthcare, but this is something that's really only seen in the city areas. So all of the places where we work are more rural areas, and when we look to those areas, access to healthcare and medical professionals is often very limited. And it becomes even more limited when potentially an individual can't afford to maybe take a day off work or travel a couple of hours away to see a doctor or visit a hospital, because that means that they will potentially lose a day of income. In Cambodia, for example, there's only 0.14 doctors for every 1,000 patients across the country, which kind of gives you a little bit of insight into how enormous that issue is. And then we have diet and nutrition. So this is an issue that is often either characterized by a lack of food, or in some cases, a lack of healthy or nutritious food. And this has been an issue in many developing nations, and also in many developed nations as well, since kind of colonization, when Western foods and unhealthy habits were introduced and really did have an impact on traditional diets and ways of eating. And one of the countries where we work, where we see this kind of being a really big issue, is Peru, where in many areas, and the area where we work, there really is an abundance of fresh fruit and vegetables, with huge varieties of things like potatoes and different grains like quinoa. But when our volunteers visit Peru, they leave with stories about how the lack of fresh food eaten, and instead they see a really high consumption of sugary drinks and fried food. And then we have water and sanitation, which we see as kind of one of the most commonly known public health issues. So in Nepal, just as a little case study, we know that 30% of people have no access to a toilet, or no regular access to a toilet, and almost 25% of the population have no access to safe drinking water. So a really big issue there. But solving or reducing water and sanitation issues could and can prevent many communicable diseases, particularly simple things like diarrhea, that's seen a lot in children, that can often lead to death. And then we have access to education and economic impact. So if you know a little bit about our programs, you will know that education is a huge aspect of what we do. And this is a result of a variety of reasons. But when we look into the statistics from Thailand, as an example, we see that 10 of their most common causes of premature death are largely preventable through lifestyle changes and by increasing access to first aid education, which really illustrates the importance of why an increase in education is so important. And also where someone kind of stands in the economy when we take into account factors like their job, their income, sometimes either their culture or religion, can often be or make them more likely to be susceptible to certain health issues as well. And lastly, we have vector-borne diseases, which are human illnesses that are caused by things like parasites, viruses, and bacteria, and are transmitted by a vector. So for example, a mosquito. And we see this as being kind of a larger issue in countries like Thailand and Cambodia and Tanzania as well. And generally people who work in agriculture, so people who are on a lower income, are at a greater risk of contracting these viruses or diseases as well. That gives you a little overview. And then, as I mentioned at the start, making sure that our programs link to the Sustainable Development Goals is a really large part of the work of our charity, the Future Sense Foundation. But these goals really help to guide our work, ensure sustainability, provide some really important direction, and also support long-term community-based goals. Our health promotion challenges mainly linked to goals 1, 3, and 6, but often have a domino effect on additional goals like gender equality and reduced inequalities as well. So let's cover what you actually do on a health promotion program. So the first aspect, and really one of the biggest aspects, are our health promotion workshops. So this is where the education component really comes in. So during the health promotion workshops, you'll likely work with mainly school partners, teachers, the children at the school, and sometimes broader community members or community groups as well. And you'll deliver sessions that are focused around health issues or maybe some large health barriers that are faced in the communities where we work. And these will be issues that are identified by our partners as kind of being the most important things to cover at a certain time. But commonly they include topics like hygiene and sanitation, diet and nutrition, non-communicable diseases, and girls and women's health can be a big focus of some groups as well. And the focus on these programs is really on improving education around these particular health topics in a way that's really fun and interactive and engaging. Next we have infrastructure support. So as mentioned on the slide, sometimes our partners maybe need some help in supporting or improving their infrastructure. So this means sometimes you might spend a couple of days of your project or a couple of mornings or afternoons working on things like supporting putting in a hand washing station, sometimes upgrading things like toilets, or painting really bright and fun and educational murals that will kind of go along what you're teaching in your health promotion workshops. And lastly, we have observation in healthcare environments. So most of our health promotion programs do involve a visit to a local healthcare centre or sometimes a hospital, which is really there to help build context and your understanding of some of the local health issues that are faced, as well as being able to look at some of the facilities that might be common in that area. And during these sessions, which sometimes run over a day or just a couple of mornings or an afternoon, you'll have the opportunity to observe some of the people that are working in that setting, and also ask questions that might help guide some of your workshops or just improve your understanding of healthcare in that area. So we often get asked about why university students, why should university students be running workshops around health issues and things like that, and maybe why can't people in the community be running those sessions? And in an ideal world, that would be what would happen, and really the long-term goals of the Future Sense Foundation in the communities where we work are to be able to get to a point where that community is completely self-sustainable and they can run these workshops and have this education without our volunteers. But right now, they're not really at a level where that is possible. And kind of, as I mentioned at the start, there really is a lack of access to health professionals, healthcare, and education as well. So that's where people like you guys and all of our volunteers really come in. So firstly, looking at the education and knowledge, our volunteers and university students in general are often very enthusiastic, they're energetic, passionate, and you have the time to spare in your semester holidays. So you can really help provide much needed education and knowledge in the community, as I mentioned before, that unfortunately just can't be entirely covered by people on the ground. We also have the great privilege of the education that we receive, and it's a great privilege and opportunity to be able to share that education with others. And really one of the ways that we think about the health promotion workshops that we run is when we think back to our schooling in Australia, where maybe 2 or 3 times a term we had different people come in from external organisations to teach us maybe about car safety or first aid or girls and women's health and things like that. So essentially you are acting as that group when teachers or community members in the areas where we work are unable to run sessions like that. Our volunteers are also really fantastic at engaging with other groups of people, and also helping the children and the students at the schools that we work with feel really excited about their learning and excited to come back to school and learn about all these different topics and really improve their knowledge and education around health issues. It can be a really, really powerful thing. And thirdly, you also have access to some fantastic resources that maybe can't traditionally be accessed in the countries where we work or can be harder to access. And you yourself are also a really fantastic resource that is incredibly valuable for our in-country teams. And they really aren't able to do their work on the ground without the help and without the support of our volunteers. And the last dot point on here, it's also really about what you're able to do once you return home. And that can be just as important as your experience overseas as well. So we want the experience to be able to broaden your ideas, build your skills, and further develop your passion. And then you're so well placed in Australia to be able to help make an impact on a local scale and to be able to share your ideas and your passion with others as well. So a quick day-to-day breakdown of just what a typical volunteering day would look like on a health promotion program. So you would normally get up around 7 or 7:30 a.m, have some breakfast at your accommodation and get ready to head out for the day. And then normally around 8:30, you will head to your project site where you will either be doing one of the three things that I mentioned before. So running those health promotion workshops, maybe doing some infrastructure support or visiting a healthcare centre. And your morning session will normally last around 2 to 3 hours. And then depending on what country you're in, you'll either have lunch at your project site, or for some people, it might be quite quick for you to head back to the accommodation. So you'll head back to the accommodation and have some lunch and a little bit of rest time there. And then you'll have another afternoon session of approximately 2 to 3 hours working on one of those three activities again. And then normally about 3 p.m, you'll head back to your accommodation, have a small daily debrief with your team, and have some time where you can plan or get some resources or prepare for your next day and week that's coming up. And then after that, we have dinner provided Monday to Friday on all of our programs. So you can have some dinner at home. There's also the opportunity for you to go out to dinner and explore a little bit if you'd like. And then that evening time is really free time for you and your team to do what you would like. And our teams in country always provide some suggestions of like some local activities to explore and different things that you can check out. And then of course your middle weekend between your first and second week is free for you to do a bit of exploring and traveling around the area that you're in. So what you will get out of it is of course a really big thing. So there's no doubt that you'll learn a lot about yourself going overseas and volunteering your time on a program. So our programs are really designed to be quite challenging and to really push you outside of your comfort zone. So by doing this, you kind of have an opportunity to re-examine yourself, maybe think about some things and explore some of your strengths and maybe weaknesses as well. Of course, you get to meet new people in a program. So you will be spending your time in a team. When you're overseas, we have lots of our volunteers make some really great new friends from being on a program, and being able to travel and work with a group of people who maybe have the same passions and some of the same goals as you or are studying in a similar area can be really, really inspiring and empowering, and also just a lot of fun as well. And then of course you will have the opportunity to have a really fun and yet meaningful travel experience that does kind of take you beyond the point of being a traditional tourist. Normally you'll get to explore locations and destinations and communities that a typical tourist wouldn't get to. So you really have the opportunity to become quite immersed in the community and the area that you're volunteering in. And lastly, you get to build some really, really great new skills. So no matter what area you're studying in, you'll gain some great universal skills that can be really important for everyone and important for your potential future career as well. So things like teamwork, problem solving, critical thinking, communication, and communication across language barriers as well are all really valuable and a great experience that you can pop on your resume as well, which can also help with getting a great job opportunity after university. The next slide just provides a little overview of all of the countries where we work, where you can participate in a health promotion challenge. So this is in every country where we work, apart from Tanzania. And I will quickly just mention that in Thailand, we both have our health promotion challenge and our Thailand paramedic challenge. So the paramedic challenge is for paramedic students. And that's really where you focus more on a specific area of first aid and also improving some of the first response abilities in the area where we work. So you might be working with different groups like first response volunteers, or we've even had a team work with the police department in running some first aid sessions. And sometimes there's an opportunity to work in the local hospital that we partner with as well in helping out in some basic checks and screening of people before they get seen by a nurse or a doctor. Okay, and I know we have Aisha and Tim here. Thank you so much for you two for both joining, as I mentioned at the start. It's really great to have you both here, and we're really thankful for you sharing some of your time with us. So let me just move this. We just have a few questions for you guys. If you can share some of your experience with people who are interested in our health promotion programs, that would be fantastic. So I'll get up our first question. Tim, I can see your mic's off. So if you want to kick off with this one and chat a little bit about maybe what was your biggest challenge on the program?
Yeah, so the biggest challenge probably would have been the language barrier that we experienced. We did have translators, which obviously is quite handy. Mm-hmm. But again, it was more so making sure that the kids understood what we were actually trying to say and get across to them.
Yeah.
So that was probably the hardest challenge out of the lot.
Yeah.
But I guess we just sort of had to repeat things a few times as well, just to make sure it sort of sunk in and became a lifestyle change.
Yeah, you can definitely learn how you can adapt, like the way that you communicate, to make sure that it's getting across that language barrier as best as possible.
Yeah, so body language and that.
Yeah, yeah. And Aisha, are you here with us?
Yeah, well, good morning. I don't know where you guys are, but good morning for me, good evening for you guys. I would say my biggest challenge was towards the end when we had to say goodbye. Mm-hmm. It was quite sad, really. Well, in Nepal, it was really like worse than the challenge that I did in Cambodia, because we had really gotten so close to them. We even went to watch like one of their games and all that. So it was, I think we also might have been the first challenge I was working with at school. I don't really remember, but that's what the children told us. And so they were really, it was a lot of tears. There was a lot of tears. That was the biggest challenge. And some of everyone was in tears, volunteers and the kids.
Yeah. Oh, that shows how special your time would have been with them though.
Yeah, definitely was. We kept in touch with some of them, and one of my volunteers is trying to fundraise because she lives in India. So, she's she doesn't live in India. She lives in Australia, but she's of Indian ancestry, and so she goes to India quite often. So
Yeah.
she's trying to fundraise for those specific group of kids to get some more resources in that school, because like that's how much she was touched by the challenge. She just wants to
Yeah.
continue on with that specific school.
Oh wow, that's amazing. Alrighty, and the second one, which is maybe a little bit more fun. What was a highlight or your biggest highlight?
Mine would probably, well, making friends with the team that I was with, but also just gaining an understanding of what was actually going on in different communities, I guess, is a highlight, because you sort of learn that you are quite privileged with where we are. But I guess, you know, it's not really a super exciting highlight, but it's just more of an understanding of what they go through.
Yeah, definitely. And Aisha?
I think it was the cultural immersion, because we weren't using tuk-tuks to go to the school in Nepal. We were walking every morning. So we left, I think, would have like 20 minutes walking, 20 to 30 minutes, depending if people stopped, and the same going back. So we ended up literally knowing the whole town, because sometimes someone would be like, hey, we haven't gone down this road, where does it lead? And then like would randomly go down, just because dinner was like still some time away. So just walk down and we'd be like, oh, this is where it goes. Of course that was scary, because like there were like some stray dogs, and one of the evenings they were just barking. I don't even know why they were so agitated. That was the scariest time, because like some of us like jumped on like towards the road, like the little sidewalk that was there, if you can even call it that. And so yeah, it did lead us into some trouble, but like we got so much cultural immersion. We found so many cool places to try food, aside from the ones that were recommended. Not a lot of us tried as food, because like some people were scared, but like we still it really felt like we were part of the little village there.
Oh, that's so cool. Yeah, walking can be the best way to like explore a new area. You see so much and notice so many different things that you wouldn't if you were driving. Okay, and Tim, if you want to kick us off with this one, what impact would you say the program has had on you, whether that's bigger or maybe something more specific?
Yeah, so, well, I actually even questioned whether I actually wanted to continue doing osteopathy after the trip, because I got such a great sense of purpose from helping the third world kids. So it really actually got me thinking as to what I wanted to do with my future.
Yeah.
Because it was such a great experience to go and help them out in their culture and all that.
Cool. I guess it makes you think about maybe like how you can bring some of these aspects into like normal life in Australia, or work that you'll potentially do in the future. And Aisha?
I think it made me realize my privilege. I did grow up in a less economically developed country. I'm from Zimbabwe. That's where I am right now. But I feel like it's still like there's like a bubble around us, even here. And then I went to, I'm in uni in Australia. That's another bubble. But then that bubble is like completely popped when you like really spending your time in those cultures. And it made me realize that some of the same situations that I hear being complained about here in Zim are still like common problems around all these other countries. So now I feel like I'm better equipped to learn how to maybe help my own community after I finish med, what I could potentially do for my community, learning from the experiences that we had whilst doing challenges abroad. So so it's long term, it's changed how I think I'm going to live my life.
Yeah, wow. Fantastic. It can be really powerful. And I know that idea of the bubble is the way that founder Arvind always describes it, like no matter where we are, so many of us live in a bubble, and it's just inevitable. You know, we get so used to our normal life and the experiences and the people that we encounter. So I think it's a really valuable experience for everyone to be able to get out of that and just see a different kind of life, and question, you know, maybe some of the ideas that you have about things as well. Perfect. I'm just going to open the chat up to any questions. If anyone wants to pop any in there, feel free, as I move on, and then I'll keep an eye on that chat box as we finish up as well. So quickly want to cover a bit of an update around COVID and what's changed for us in regards to our programs and flexibility that we offer. So we have introduced some new flexibility options to help people feel comfortable and secure and confident in booking a program in 2021, but knowing we have these flexibility options there for you if you're unable to travel for a particular reason or want to change your program. So the first one is our no change of date fees. So if you book a program, say for June or July next year, and then are unable or you don't want to travel on those dates anymore, you're able to travel, change or postpone to different dates, either towards the end of 2021 or even in 2022, and you can do that with no fee or no cost. We also have our full program flexibility. That means if you register for a particular program, say our Thailand Community Challenge, for example, and then decide you want to change to maybe our Nepal Health Promotion Challenge, again, you can do that with no fee, and yeah, we're happy to change that over and transfer anyone's program over. And then lastly, we have our fully flexible payment plan. So that means that after you secure your spot on a program with your deposit, you are able to pay off the rest of the cost of the program in a way that suits you. So whether that's making fortnightly, monthly, or quarterly installments, it's up to you how you would like to pay. And then health and safety has always been one of our biggest priorities on all of our programs, but we are, of course, introducing additional health and safety measures in all of the countries where we work and reviewing our practices as well. So these additional measures will include things like fewer people sharing rooms and bathrooms, more frequent and deeper cleaning of our accommodation, and sorry, I've lost my train of thought. Mandatory hand washing before all meals as well. So this is something that was obviously assumed and encouraged pre-COVID, but is definitely something that we will be strictly enforcing from this point onward on any of our programs. And as I mentioned at the start, we have a new project coming soon. So these are our virtual internships, which we will be launching soon and sharing some more information about on our social media channels and our website soon. But it's basically a way for anyone who doesn't want to wait until travel opens up again to start working with us and volunteering some of your time and building some of those skills as well. You will have the opportunity to look at the possibility of a virtual internship. So definitely keep an eye out for that one. And as I finish up, I just wanted to share all the different ways you can learn more and get in touch with us. So you can, of course, send an email to us, which is hello@challengesabroad.com.au, for everyone in Australia or all of our Australian university students. You can also book in a call with us directly. So you can check out our calendar and just put in your details and book in a call, and we will call you at that time to chat about any questions you have, or maybe help you decide what program would be best for you. We would also love if you can check out our social media channels. And these are a great way to stay up to date with some of the things that we're working on and updates from our country teams as well. And check out our YouTube if you want to see some videos and hear from more past participants that have been on our programs. And of course, you can always head to our website to just read more or learn a little bit more about the programs. I don't think we have any other questions, so we'll get ready to finish up. But again, thanks so much, Tim and Aisha. It was great to have you on today and to reconnect a little and hear about some of your experience as well. If nobody has any questions, we will finish up the session today. But thank you again to everyone joining.